Good day to one and all. It's another great day to explore about horses. I am Kyla Hanalay Lozari Lamata and I am joined with my group mates in Group 5, Kale Mori Alagano, Christine Kate Bonocan, Ayla Corinne Cubias, Chester Kent Paravillas, Jade Wallens Rizal, Cassandra Celine Segumban, and Shirlene K. Escote. Today, we are going to discuss common equine diseases and health management in horses. Let's begin. Common equine diseases. The immune system of the horse is fascinating and complex, yet typically effective physiological means of fighting off disease-causing agents such as bacteria, viruses, and other pathogens. They have a specific or adaptive immunity that is acquired and improves with time. As the immune system encounters different antigens, it learns the best way to attack each type and it begins to develop a memory for that antigen. Horses are social creatures, and they have a host of infectious diseases that plague them from time to time. Horse disease is passed from horse to horse or by a parasitic host. These diseases are dangerous and can be fatal. We need horses to be free from diseases and have a good immunity in order for them to function well and be of good use to humans, considering their purpose of being a work animal. Furthermore, we are going to discuss to you today the common equine diseases. First up, we have bacterial diseases. Bacterial diseases. Bacterial infections are diseases that affect the skin, lungs, brain, blood, and other parts of the animal's body. These can be acquired from single-celled organisms multiplying or releasing toxins in the body. Here are the common equine bacterial diseases: anthrax, botulism, canker, Lyme disease, Potomac horse fever, rain rot, salmonella, strangles, and tetanus. Anthrax. Anthrax can affect all warm-blooded animals, including humans. Horses become infected with anthrax either through ingestion, inhalation, or skin penetration by biting flies or injury, especially when animals are exposed to soil or carcasses of infected animals. If ingested, clinical signs include loss of appetite, colic, enteritis, fever, trembling, depression, and bloody diarrhea. Death usually occurs within 48 to 96 hours. Diagnosis or treatment. When natural anthrax affects large animals, as in horses, antibiotics of choice include penicillin and oxytetracycline. Anthrax is controlled through vaccination programs, rapid detection and reporting, quarantine, antibiotic treatment of any animals exposed to the bacteria but not yet ill, and the burning or burial of dead animals that had suspected or confirmed anthrax infection. Botulism. Botulism, also known as Shaker-Fowl syndrome, is caused by a gram-positive, spore-forming anaerobic bacterium that survives in soils, freshwater sediments, and marine sediments called Clostridium botulinum. Infection is often the result of ingestion and infection of deep wounds of the toxin through contaminated feed. The toxin prevents the release of acetylcholine at the neuromuscular junction, resulting in paralysis, especially of the cranial nerves. Let's take a look at this video of a horse suffering from botulism.
But not until, yeah. So it's just critical that these horses not be stressed or bothered. Okay?
The first sign of this horse disease you may notice on your horse is the inability to swallow or a lot of drooling. The horse may not be able to get up after lying down and he may begin to lose control of his muscles. In the early stages, you may also see his muscles quiver and tremble. No specific diagnostic test for botulism exists, and blood work on affected horses is typically normal. Veterinarians make a diagnosis based on clinical signs. Although serum and feces can be submitted to a lab for toxin analysis, the vet will probably begin treatment immediately because time is of the essence when you're combating this disease. Treatment involves giving the horse hyperimmune plasma that's very high in antitoxin titers. However, because botulism types vary, the vet has to use plasma that's specific to the particular toxin that affected the sick horse. To help prevent botulism, inspect your horse's hay regularly for animal carcasses that may have been accidentally boiled into it. If you find animal parts, don't feed the rest of the bale to your horse, and keep an eye on him for possible symptoms. Wound botulism can be prevented by calling a veterinarian right away if your horse seriously injures himself. Immediate treatment of the wound can help ward off this horse disease. Equine canker is a chronic hypertrophic moist pedodermatitis of the epidermal tissues of the foot. The most common isolated agents include Fusobacterium necrophorum and one or more bacteriums. Here's a video showing painful canker in horse hoof.
You can see this is her frog, and this part here is the canker. And you can see the white kind of down here as well. It's very sensitive. It'll bleed easily, and it goes deep into her central sulcus.
The exact cause of canker is unknown, but most horses affected by canker have a history of being housed in wet areas year-round. Lameness usually does not present until the corium is involved. Equine canker has a characteristic odor. The frog usually is very friable and has a cottage cheese-like appearance. Treatment often involves superficial debridement and topical antimicrobial agents. As the bacteria found in hoof canker cases lives in soil, the best way to prevent the condition is to keep the hoof clean and dry. Daily picking out of the horse's hooves will likely prevent the condition from developing, and this may be especially important for horses in wetter environments. Next, we have Lyme disease. Lyme disease is caused by at least 3 strains of Borrelia burgdorferi, a gram-negative unicellular spirochete with flagellar projections. Infection of the horse occurs when a tick attaches to a horse for longer than 24 hours. For successful transmission of the bacteria, the tick must be attached for at least 24 hours and sometimes up to 48 hours. The organism lives in the tick's gut and is transferred as it feeds on the blood of the horse. Clinical signs include low-grade pyrexia, depression, stiffness, lameness, loss of appetite, joint swelling, and eye problems. However, when high fevers and leg edema are present, the condition most often is the result of Anaplasma phagocytophilia because many ticks are infected with both Anaplasma phagocytophilia and Borrelia. Diagnosis of Lyme disease usually is accomplished with enzyme-linked immunosorbent assay or ELISA or immunofluorescent antibody testing. Treatment of Lyme disease includes intravenous tetracycline and oral doxycycline. Doxycycline cannot be administered intravenously to horses because of the potential side effects. Tetracycline should not be administered orally to horses due to low bioavailability and the risk of having active drug reaching the colon and causing diarrhea. Prevention should include use of an insecticide, use of antimicrobials if early exposure to ixodes is known to have occurred, and of course, vaccination. Potomac horse fever. Potomac horse fever is caused by the bacterium Neorichitsa ricisi, formerly known as Ehrlichia ricisi. It is a gram-negative obligate intracellular bacterium with an attraction to monocytes. As shown in the illustration, Neorichitsa ricisi lives inside trematodes or flukes that infect snails. When the trematodes release their larvae and enter a water environment, the larvae are infected with Neorichitsa ricisi. The larvae of the caddies and mayfly, which also live in water, consume the infected trematode larvae and become infected with Neorichitsa ricisi themselves. When the caddies and mayfly larvae hatch, they are infected with Neorichitsa ricisi. If a horse then accidentally eats one of the flies, the horse becomes infected. The bacteria will begin to replicate inside the gastrointestinal tract of the horse, causing the clinical signs of depression, diarrhea, fever, toxemia, abortion in pregnant mares, and sometimes laminitis. A definitive diagnosis requires identification of Neuritis aristici in the feces or blood of the infected horse. A polymerase chain reaction or PCR test is available for detection of Neuritis aristici. In treatment, it often involves oxytetracycline of the disease if diagnosed early, most often resolving clinical signs within 3 days. Fluid therapy and non-steroidal anti-inflammatory drugs or NSAIDs may be provided as supportive treatments. Next, we have rain rot. Rain rot is caused by Dermatophilus congolensis, a gram-positive non-acid, fast, facultative anaerobic actinomycete. Dermatophilus congolensis also infects cattle, sheep, goats, pigs, cats, and dogs. Rain rot often represents in area with high temperatures and high humidity. Animals that are wet for prolonged periods of time often develops this disease. We're going to play a video that displays rain rot in horses.
So you can see here, Prince has these crusty bumps forming on his rump. This is the stereotypical manifestation of rain rot.
Rain rot symptoms. The condition can affect animals of all ages and presents as crusty scabs or matted tufts of hair. The lesions are usually found on the head, neck, and chest. Yellow or green pus can be found underneath larger scabs. A definitive diagnosis is made from culture and identification of the bacterial congolensis. Treatment includes antimicrobial therapy. In horses, the lesions should be soaked and removed. In food-producing animals, lime sulfur can be used as a more cost-effective treatment. Salmonella. Several Salmonella serotypes can cause diarrhea in adult horses. 5 of the most common serotypes are Salmonella agona, Salmonella Newport, Salmonella annatum, Salmonella Crefeld, and possibly the most pathogenic, the Salmonella typhimurium. Horses infected with Salmonella can have one of the 3 types, which are the carrier, mild clinical, or acute clinical. The symptoms include fever, loss of appetite, severe watery and foul-smelling feces. Diagnosis of the disease is based on clinical signs, neutropenia, and fecal cultures. Culturing a rectal biopsy can increase the chances of identifying the organism, but is not without risk to the patient. Treatment of Salmonella infections, both the mild clinical and acute clinical forms, should be treated with IV fluids and electrolyte replacement. Due to the zoonotic risk and contamination of other horses with Salmonella, clients and other facility staff must be educated on the importance of quarantine. Prevention of Salmonella can be very difficult because Salmonella is present in the environment. Next, we have strangles. Strangles or distemper is caused by the bacterium Streptococcus equi. Streptococcus equi is a gram-positive coccoid often transmitted through the nasal discharge produced from an infected horse. The transmission can occur via direct contact or indirect contact. If the abscesses spread throughout the body, the disease is often called metastatic strangles or bastard strangles. A horse with strangles often presents with a sudden fever, mucopurulent nasal discharge, and abscessation of the submandibular and retropharyngeal lymph nodes. The submandibular and retropharyngeal abscesses may make it difficult for the horse to swallow. Some horses may become listless or anorexic. Diagnosis of strangles is performed with culture of nasal swabs, pus from an abscess, or nasal washes. Other forms of diagnosis can include polymerase chain reaction or PCR and serology. In terms of treatment, when drug therapy is used, penicillin is often the drug of choice. Most horses will recover from the disease with rest and palatable food. Warm compresses can be used to mature the abscesses, and once the abscesses have ruptured or been lanced, they should be flushed daily with providone iodine solution. Let's take a look at this video of abscess draining in horses with strangles. Fair warning, the following scene is very graphic in nature and might be disturbing to some viewers.
If he needs more, feel free. Oh, look at that.
And lastly, for prevention of the disease includes vaccination. Tetanus. Tetanus is caused by endotoxins produced by the bacterium Clostridium tetani, which is a motile anaerobic gram-positive bacillus. The most common cause of infection is contamination of wounds. Puncture wounds that contain rusty metal, dirt, or manure are particularly likely to cause infection. Contaminated surgical incisions and umbilical structures may also lead to tetanus infections. Symptoms. The incubation period of tetanus ranges from 1 to 60 days, but usually averages between 7 and 10 days. The disease begins with generalized stiffness. With mild infections, the stiffness may remain localized in the head and neck. Stiffness leads to the characteristic stance known as the sawhorse appearance, in which the head, neck, back, and legs are stiff and the tail head is elevated, as shown in this video. In some more severe cases, the horse may even be recumbent and dyspnea may be seen. Diagnosis is often based on clinical signs. Treatment should include placing the horse in a quiet, dark area. Water and feed should be placed high in the stall so that the horse does not have to lower its head to eat and drink. Some horses may need body support to prevent them from falling. The wound should be cleaned and tetanus antitoxin can be infiltrated around the wound. Sedatives and muscle relaxants can be used to control the muscle stiffness. Mortality is often 50%, and horses that survive the disease usually stabilize within 2 to 7 days, with gradual recovery over a few weeks. Now we have other microbial diseases, which includes equine protozoal myoencephalitis, dermatophytosis, and white line disease. First, we have equine protozoal myoencephalitis. Equine protozoal myoencephalitis, or EPM, is caused by a protozoan, the most common of which is Cercospicys neurona, and is the most commonly diagnosed neurological disease in horses today. The opossum is the host of this disease. Birds can carry this nasty little parasite in their muscles. The opossum eats the birds and passes the organism out through their stool. Horses then get the disease from eating food or water that's contaminated with the opossum's feces. The APM protozoa affects the spinal cord and brain, resulting in a variety of symptoms including incoordination of one or both rare limbs, stumbling, muscle atrophy, and other subtle to severe neurological signs, such as bucking under a saddle, an inability to execute lead changes, and unequal stride length. Any signs of brain and spinal cord problems can also signal the horse disease, EPM, from paralysis to loss of bladder control and urine dribbling. At this time, the most definitive test for horse disease EPM requires examination of the cerebrospinal fluid drawn from a spinal tap in conjunction with clinical signs. Other tests are currently being developed. Only a few approved products are on the market to treat this disease. The success of treatment depends on the individual horse. While some horses recover completely, while others retain some neurological damage from the rest of their lives. Recurrence of the disease is also a possibility. To help prevent the horse disease EPM, We should keep water and feed resources clean and as free from contamination as possible. Keep trash covered in secure containers to avoid attracting opossums to your property. And remember too that any horse kept outdoors anywhere can be exposed. Another microbial disease we have is dermatophytosis. Dermatophytosis is also known as ringworm. It is a common superficial cutaneous fungal infection caused by keratinophilic fungi that invade the stratum corneum of the skin and other keratinized structures. Trichophyton equinum is the most common agent that causes ringworm in horses. Ringworm is highly contagious and is spread by direct or indirect contact. Indirect contact includes sharing tack, stalls, feed and water containers, and insects. The fungus can survive on these items for up to 12 months. Clinical signs include small round lesions covered with small scales. The hair often breaks off just above the skin level. Older lesions may heal in the center, but the edges are quite active. Identification of ringworm can be made with a wood lamp or by culture or histology. Treatment of ringworm can be accomplished with povidone iodine, thiabendazole ointment, sulfur dip, miconazole, ketoconazole, fluconazole, or Captan. The environment can be treated with diluted bleach in 1:40 ratio and by elimination of infected tack. Lastly, we have white line disease. This disease is caused by the invasion of bacteria, fungus, or yeast into the inner horn. When the infection results from fungus, it is also called onychomycosis. Symptoms: the affected area of the hoof fills with a cheesy material and air pockets that are often packed with debris. The infection starts at the ground and, if left untreated, can migrate to the coronary band. Clinical signs are often similar to those of laminitis. The horse may be lame or its sole may be warm to the touch. Sometimes the pockets are filled with a black, foul-smelling similar substance to thrush. Treatment involves resection of the underlying hoof wall and topical application of an antiseptic.
Good day everyone, I am Jade Valens and I will be discussing the following. Horse disease that is caused by bacteria can be fatal. But now let's proceed to a few diseases caused by viruses, also known as viral diseases. Viral diseases are any disease that equines get from a virus. Some common diseases are encephalomyelitis, equine arteritis, equine infectious anemia, and rabies. Encephalomyelitis. Viral encephalomyelitis is a viral disease of the nervous system. There are three strains of the same disease that can infect the horses, which are called Western equine encephalomyelitis, Eastern equine encephalomyelitis, and Venezuelan equine encephalomyelitis. These illnesses can cause severe neurological symptoms and often death. The virus lives in the host like birds and rodents, and all strains of the equine encephalomyelitis viruses are spread by blood-sucking insect, specifically the mosquito. Common symptoms of these diseases are lack of appetite and persistent fever. If the viruses is not successfully cleared by the horse immune system after the initial infection, these sources disease can cause neurological behaviors such as circling, seizure, stumbling, and lethargy. As these horses disease progresses, the horse may begin head pressing, which is pressing the head against the wall or other object, which leading, becoming blind, and fall into a coma. The encephalomyelitis virus may be diagnosed by blood tests or on postmortem testing. Currently, there are no treatment for encephalomyelitis. However, veterinarians can provide supportive treatment for affected horses in the form of intravenous fluids, anti-inflammatories, and anti-diarrhea medication. For the prevention, vaccinating your horse is the best way to prevent serious infections with the encephalomyelitis, and removing standing water and stocking it with mosquito fish can help reduce mosquito population. Also, spray your horses with mosquito repellent and keep the horses indoors at night to prevent the mosquito biting your horses. Equine arthritis. Equine viral arthritis is caused by the equine arthritis virus. The disease is transmitted through either respiratory particles or venereal roots. Even though horses can transmit the disease through bodily fluids like urine, aborted fetuses, and aerosol, infected semen is the primary source of infection. Symptoms in adults often include abortion, respiratory sign, and fever. In foals, clinical signs can include pneumonia and enteritis. To confirm cases of equine arthritis, virus isolation, paired serum samples, viral antigen, or viral nucleic acid detection should be used. Treatment of horses with severe infections includes NSAIDs, fever-reducing drugs, diuretics, and rest. Most adult horses recover eventfully. There is no effective treatment for foals with pneumonia or for carrier stallion. Stallions that carry the viruses should be surgically castrated. For the prevention, vaccination should be done to prevent these viral diseases. Equine infectious anemia. Equine infectious anemia is caused by the equine infectious anemia virus, which is a lentivirus of the Retroviridie family. The disease is transmitted through blood-sucking insect, primarily the mosquito. When clinical signs are present, horses often develop a fever, becoming lethargic, and is anorexic. The mucous membrane appears pale and maybe have petechia. The animal may be ecteric and neurological signs may be developed. Diagnosis can be made by the serologic testing. Four serologic tests are accepted by the United States Food and Drug Administration, which are the Agel Immunodiffusion Test, ELISA, ViraCheck ELISA, and the synthetic antigen ELISA. For the treatment, there is currently no specific therapy for horses that are diagnosed with the equine infectious anemia. Most often, the horses are recommended for euthanasia. Rabies. Rabies is a neurologic disease caused by a virus in the genus Lyssavirus. All mammals are susceptible to rabies and it has the highest case of fatality ratio of any infectious disease. However, rabies is relatively rare in horses. For the symptoms, rabies in horses can progress rapidly with survival time ranging from 2 to 5 days to 2 weeks. Symptoms include inability to stand, uncoordinated movements, and muscle weakness. Excessive sensitivity to touch, muscle tremor, lameness, anorexia, loss of tail, and anal sphincter tone, loss of sensory perception in the hind limbs, fever, colic, lethargy, convulsion, self-mutilation, and lastly, aggressiveness. For diagnosis include laboratory tests and postmortem evaluation of brain and salivary gland tissues are commonly used for diagnosis. For the treatment, currently there is no treatment for rabies in horses. For the prevention of these viral diseases, vaccination should be done. Non-infectious diseases are not caused by pathogen and therefore cannot be spread from one equidae to another. Common diseases include kidney dysfunction. The kidney's most important function is to filter waste from the blood. When this does not happen properly, waste product can build up to dangerous level in the blood. This is called azotemia. Azotemia can lead to kidney failure when waste product build up in the blood, causing damage to kidney, leading to kidney failure. Chronic kidney disease and kidney failure can damage the kidneys so severely that it is not able to function properly, and there is rarely anything a veterinarian can do to treat it. Occasionally, chronic kidney disease results from a problem that is inherited or an abnormality present at birth. However, most of the time, it is a problem related to old age. Symptoms include unexplained weight loss, excessive thirst, and excessive urination. Diagnosis. To diagnose a chronic kidney disease, veterinarians generally use a combination of X-ray, ultrasonography, urine and blood tests, and lastly, physical examination. Treatment involves identifying the underlying cause of kidney disease and treat it with supportive treatment such as intravenous fluids and feeding tubes. Acute kidney disease. Acute kidney disease is the result of a sudden, major damage to the kidney. This damage is usually caused by the toxic chemical either consumed by your horses or built up by an abnormal condition in your horse's body. Acute kidney disease is caused by lack of oxygen in the kidney, dehydration, bleeding, infection, and general anesthesia. Inflammatory airway disease. Inflammatory airway disease is also described as mild to moderate equine asthma. IAD is a respiratory disease that typically affects young horses as early as 1 year of age. Cough, poor performance, and excess mucus within the airway on endoscopy is a characteristic of IAD. Symptoms include long-term cough without fever, poor or diseased performance with more strenuous work, longer respiratory recovery rate after work, mild watery to white nasal discharge, particularly after exercise, and lastly, with worsening disease, horses can become exercise intolerant. Diagnostic tests are needed to differentiate IAD from other diseases, such as HIV, bacterial infections, viruses, and parasitic infections. These tests include endoscopy, lung wash, tracheal wash, and more advanced test beating to rule out other causes and confirm IAD. For the treatment, treat airway inflammation. Expanding the airway that are abnormally constructing is the treatment for IAD. Parasite are organisms that lives in or on an organism of another species and benefit by deriving nutrients at the other's expense. Parasites are a major cause of colic in horses, but can be reduced by following a preventive deworming program formulated with help from a veterinarian. Large and small strongyles, tapeworms, and bots present the greatest health risk. Bots. Bots are the larvae of the botfly, which hatch and enter the horse's mouth, where they are swallowed and attached to the stomach lining, causing irritation, interfering with digestion, and obstruct the small intestine. For the diagnosis and treatments, the presence of botfly adults and eggs is a strong indication that horses have been exposed to and may be infected with bots. Treatment should be scheduled from the time botflies are seen in the environment or eggs are observed until a month after the first hard frost. Strongyle. Strongyles are also known as bloodworms, are a parasite ingested by the horse that can cause colic, anemia, diarrhea, weight loss, poor performance, and other problems. There are two types of strongyles, large strongyles and small strongyle. For the large strongyle, Strongylus vulgaris, Strongylus studentatus, and Strongylus equinus are the three species of large strongyles that infest horses, causing extensive damage to the lining of the blood vessels and organs. In extreme cases, the blood supply to the intestine may become completely blocked, leading to severe colic and sudden death. Small strongyles are the most common internal parasite of horses that can cause severe damage to the intestinal lining. Signs include loss of condition, weight loss, poor condition, and slowed growth. For the diagnosis and treatments, regular deworming is recommended to reduce the risk of serious problems from the strongyle infestation. Small strongyles are more difficult to treat, requiring higher dose of dewormer for a number of consecutive days. Tapeworms are fairly common in horses. Studies have found that nearly 60% of horses in an area to be infected with the tapeworms. Adult tapeworms live in the horse's intestine and steal nutrients from the food by attaching themselves to the ileocecal valve. For the diagnosis and treatments, tapeworm infection in horses may lead to varying degrees of colic, poor growth, lethargy, rot haircut, and poor performance. HIV infestation can cause ulcer, intestinal blockage, or even intestinal rupture. It is important to include treatment for tapeworm in the deworming plan because many commonly used dewormers do not kill tapeworms. A specific product may need to be added in the deworming program to prevent tapeworms. Environmental measures that break the life cycle of internal parasite can be as important as in deworming for the control of internal parasite in horses. Following good management practice to control the frequency and spread of internal parasite. Here are some important points about parasite prevention. First is remove manure daily from the stalls and run in and weekly or more frequently from paddocks and pasture. Be sure be sure pastures and paddocks are well drained and not overpopulated. Compost manure rather than spreading it on the field where horses graze. Use a feeder for hay and grain and avoid feeding on the ground. Implemented fly Implement fly control programs. Keep water through and feed bins clean. Routinely examine horses for telltale sign of infestation. And lastly, establish a parasite prevention and monitoring program with your veterinarians. This may include regular manure check and deworming program tailored to the needs of your horses.
So my name is Chester Kent Maravillas. I'm going to discuss to you the equine health management. So to keep your horse healthy, it's very important to vaccinate your horse to certain diseases, or deworm it regularly, or properly care for the teeth and for the other feet. Horses are also susceptible to conditions such as colic and dermatitis, which can greatly diminish the usefulness of the horse or even can cause death. Before pursuing equine production, health management is very important to know, since it covers a lot of important topics. For example, we have the vaccination. Vaccination is very important since it can list the severity of some diseases which can cause death or even can affect the horse performance. Disease transmission. According to the Center for Food Security and Public Health, diseases are transmitted through these routes. First, we have the aerosol transmissions. Infected droplets pass from one another to another, which is through the air. For example, an animal coughing, which can be passed to the another animal. Second is with the oral transmission. Diseases causing agents are consumed in contaminated food, feed, or water, or by the licking or chewing on contaminated objects. Third one, we have the direct contact transmission. A susceptible animal contacts the disease agent through an opening, wound, or mucous membrane, or through saliva, blood, nose-to-nose contact, rubbing, or biting. Also, in reproductive diseases can spread directly to the mating or in utero. The fourth one, we have the vehicle transmission. An inanimate object carries a disease-causing agent from one susceptible animal to another. This is very famous in global merchantry, which can pass the diseases. For example, we have the ships. The fifth one, we have the phonite transmission. Disease agents spread through contaminated food, water, and soil. Traffic transmission, a subtype of phonite transmission, is a spread when disease-carrying organic materials is carried from one location to another. A vehicle, a trailer, or person can transfer this material between locations. The sixth one, we have the vector-borne transmission. Insects or ticks carry a disease agent from one animal to another. Mechanical transmission happens when the vector carries the pathogen directly from an infected animal to susceptible animal. Biological transmission occurs when the pathogen undergoes a biological function within the body of the vector before being transmitted to susceptible animal. Management of disease transmission. So the Center for Food Security and Public Health has this suggestion for minimizing the risk of disease transmission. First is the aerosol transmission of disease can be lessened by increasing the distance between animals. Knowing the wind speed, temperature, humidity, or the direction of the wind can influence this form of disease transmission. Barns should be well ventilated. Have multiple water sources and feeding locations to decrease the number of horses in one area. Oral transmission can be decreased through proper pasture maintenance. Do not allow hay to be contaminated by feces. Check water sources frequently from contaminants that might accumulate from runoff. Also, when traveling with horses, bring a grain of hay and water from home if possible to lessen the possibility of oral diseases. Management of direct transmission by quarantining new arrivals to the farm. Reduce the risk of reproductive diseases by making sure the stallion and the mare have blood through breeding soundness examinations. Mare examinations should be included in uterine culture to identify the potential pathogens. To prevent a vehicle transmission from inanimate object, workers should change or thoroughly clean clothing, shoes, and equipment after working with new quarantined or sick horses. Fomite transmission can be reduced if workers do not move items such as tractors, manure, spreaders, wheelbarrow, manure forks from one another or to another farm without making sure that all the organic material has been removed. To prevent insect infestation, remove all standing water from around the barn and water tanks. Make sure the wash racks drain properly, or the manure or compost pile should be as far from the barn as possible and remove oftenly or clean often. Complete vector eradication extremely difficult. Different types of sprays, baits, and having varying results. Placing birdhouse in barn area help to the insect control. Releasing wasps that eat fly larvae may help, but insect sprays will kill these wasps. So now the vaccinations. Vaccinations can prevent some infectious disease in horse, but only if administered before a horse is exposed to a disease. Vaccinations are prepared from killed microorganisms, living attenuated organisms, or living fully virulent organisms. For most vaccines, a primary and booster vaccination are required. When an animal is exposed to a vaccine, its body makes antibodies to combat the foreign material in the vaccine. If the animal is later exposed to the disease, the body recognizes it and rapidly produces more antibodies. The handler administering vaccine should be able to recognize the treat acute anaphylaxis. Anaphylactic shock is often severe and sometimes fatal reaction to a second exposure to a specific antigen. So symptoms are respiratory distress, fainting, itching, and hives. The American Veterinary Medical Association, or AVMA, divided these vaccination recommendations into two categories: the core and the risk-based. So before we proceed, here's a short clip of video on the injection sites of horses for vaccination.
Hey folks, Dr. Tony here with Valley Vet Supply. Today we're going to talk about injection sites and needle selection for vaccinating our horses. We generally use an 1.5 inch length needle and an 18 to 20 gauge depending on the thickness of what we're injecting. When we're injecting medications, most medications and vaccines are administered intramuscular. And so the most common site is going to be on the neck here. And we talk about an injection triangle. So the landmarks of the triangle are going to be right in front of the shoulder blade here, above the vertebrae that run right here, and below the nuchal ligament. So your injection triangle is going to be in this area right here. Another common site that we administer injections is in these pectoral muscles. And so we've got two large muscle groups here that we can administer a vaccine. And as we move back, another common injection site is in the top of the hip here. And our landmarks for that are going to be the points of our bones. We've got a bone here and a bone up here and then here. And we draw a triangle between those, and right in the middle is our injection site. The last place that we commonly administer a vaccine is right here in the muscles in the back. We need to be careful because a nerve runs right through here, so we want to make sure we stay close to the middle. As we're administering this, due to the risk of being kicked, we typically recommend standing on the opposite side and administering it into the opposite leg.
So now, let's move to our next topic, which is the two types of vaccination.
Core disease vaccinations. First one, we have the tetanus. Tetanus toxoid vaccine is recommended for all horses. A booster should be given each year and when the horse is injured or has a surgery. If the last dose was more than 6 months earlier, fowls should receive 2 to 3 vaccinations regardless of the vaccination status of the mare. If the dam was unvaccinated, begin the series of vaccinations when the fowl is 1 month old. If the dam was vaccinated, begin the series of vaccinations when the fowl is 4 months old. The encephalomyelitis, it's a monovalent, bivalent, or trivalent horse vaccines are available. Horse owners should choose vaccines based on the prevalence or likely occurrence of the diseases. The APP guidelines suggest that in endemic areas, booster for Eastern and Western should be given every 6 months. Boosters for Venezuelan are needed only if this exposure is threatened. Venezuelan vaccine may only be available as combination with the Eastern or Western vaccine. An annual booster for adult horse and 3-dose series for false weanlings are recommended. Number 3, we have the rabies. Rabies can be prevented by vaccination. The AEPP recommends vaccinating horse where the disease is endemic, but not with modified live virus vaccines. A single annual vaccination is recommended. Broodmares should be vaccinated before breeding. Fourth one is we have the West Nile virus. Recommended giving annual booster after the primary series in endemic areas. Boosters are determined by local conditions. For the fowl and weanlings, the 3 doses series is recommended based on the vaccination status of the dam. Risk-based vaccinations. Risk-based vaccinations are only given to horses that have higher risk of being impacted by a specific disease. First, we have the anthrax. Anthrax can be controlled through vaccination and quarantine. The non-encapsulated strain vaccine is used for livestock. Vaccinate livestock to 2 to 4 weeks before the seasonal outbreaks are expected. Do not administer antibiotics within 1 week of inoculation with a live vaccine. Additional control procedures are necessary to contain the disease. Soil can be decontaminated with formaldehyde if not excessively contaminated. The process generally requires removing the soil, and the carcasses in suspected confirmed cases should be burned. We have the botulism, vaccinating fowls and weanlings in endemic areas. These 3 doses series of toxoid is given at 30-day intervals starting at 2 to 3 months of age. Fowls from non-vaccinated mares may benefit from inoculations at 2 to 4 and 8 weeks of age. Transfusion of the plasma from vaccinated horse or antitoxin. Bred mares should receive a 3-dose series at 30-day intervals, with the last dose 4 to 6 weeks prepartum and annually treat thereafter for 2 to 6 weeks of prepartum. Equine herpes virus. Frequent vaccination are required to maintain their resistance. The AEPP recommend a 6 revaccination interval for horses that less than 5 years old, horses on breeding farms or in contact with pregnant mares. In performance, horses at high risk give special attention to the fowls, yearlings, stallions, and the brood mares. The equal viral arteritis. This preventable disease can be controlled by sound management practices and selective use of modified virus vaccine. The AEPP suggests vaccinating breeding stallions and teaser annually 28 days before the start of the breeding season. Unvaccinated mares do not develop clinical signs even though they become transferentially infected by Maishid virus for a short time. Do not use it in pregnant mares, especially in the last 2 months of gestation or in fowls less than 6 weeks old, unless the risk of exposure to natural infection is high. Annual vaccination should be given to the colts intended to breeding stallion before the initial vaccination in intact males and horse intended for export. Influenza. 2 types of vaccinations are available for horses, an inactive injectable and an intranasal modified live virus. The APP recommends a series of less 3 doses for fowls beginning at 6 months of age. Use the inactive vaccine for prepartum booster in brood mares. Vaccinate mature horses twice a year if they are at high risk. Potomac horse fever. The APP recommends a vaccination interval of 3 to 4 months. When the disease risk is high, fowls should receive a 2-dose series beginning at 5 months of age. Rotavirus A. The APP recommends testing fowls for the level of the cholesterol antibodies. Pregnant mares should be vaccinated in each pregnancy at 8, 9, and 10 months of gestation. Vaccination is not recommended for fowls for other classification of horse. The strangles. Mature horses should be vaccinated semi-annually. Vaccines containing M protein extract may be less reactive than wholesale vaccines. Foals as young as 4 weeks may safely receive the intranasal strangle vaccination.
Good day everyone, I am Kristen Kate Pibonacan and I am going to report the health management in horses, the parasite control, the dental care, the hoof care, colic and laminitis, and lastly, the importance of exercise in horses. Let's proceed to our first topic, which is the parasite control. Parasite control. Horses are susceptible to internal parasite infestation. Parasites can be controlled through regular deworming programs and proper waste pasture management. Some indications of parasite infestations are weight loss, rough hair coat, loss of appetite, listlessness, tail rubbing, and colic. The most prevalent parasites are the strongylls or the bloodworms, ascarids or the roundworms, bots, and pinworms. So, ang strongylls is a common disease among grazing horses and it is caused by infection with a group of nematode parasites known as strongylls. So, it only occurs when horses graze on pastures that is contaminated with strongyl larvae, which hatch from eggs passed in the feces of infected horses. The horse ascarids or roundworms are stout yellow or white worms that can reach up to 15 inches long. Horse bots are honeybee-sized flies that dart around and glue their tiny eggs or nits to body hairs of horses, donkeys, and mules, and the fast movements of these flies frighten animals. Lastly, the pinworms. They crawl out of the horse rectum. The only damage that pinworms cause is itching of the tail head, and this annoys the horse but doesn't threaten its life. It is recommended that your horse be dewormed 4 to 6 times per year. The frequency of deworming needed varies based on herd size and stocking rate, as well as the age of the animals. So pag maraming horses in a small pastures, then they need to be dewormed more frequently than those kaunti lang na horses in a large area. So there are 3 common methods of deworming. First one is the feed additives. Feed additives. If the additive is in daily feed, it will need to be boosted with a bolus deworming treatment periodically. The second one is the oral tube of paste. So most deworming nowadays are now available in easy-to-use tubes. Lastly, the stomach tubes. This method involves passing a tube through the horse nose and into its stomach. So it should be only performed by a veterinarian. When developing a deworming program, it is necessary to rotate the type of anthelmintic because pag paulit na paulit ang deworming medication, that type of deworming medication, then the parasites can develop a tolerance to compounds over time and eventually magiging resistant sila sa medication. External parasites such as lice, ticks, grubs, and ringworm are seldom a problem if the horse is kept clean and groomed regularly. Dental care. The horse chews its food in a grinding fashion and thus evenly wears off the surface of the molars. And in some situations, the horse does not evenly wear its molars and points can form, making eating painful because these points can irritate the tongue and cheeks. Therefore, the horse chews less and feed is utilized less efficiently. When points occur, ang gagawin lang is that they need to be filed off and then the horse will eat comfortably again. So there are indications of sharp points on the molars, and these are the weight loss, whole kernels of grain in the manure, and slobbering while eating. Horses also develop wolf teeth on top jaw in front of the first molars. So horses also develop wolf teeth on the top jaw just in front of the first molars. If they cause discomfort, they can be easily removed by a veterinarian because these 2 teeth are not rooted. Problems with wolf teeth are usually noted when the horse is ridden with a bit, which can bump against the teeth and cause discomfort. Although uncommon, Horses can also develop abscesses, impacted teeth, or a variety of other dental problems. Teeth should be checked at least once a year for presence of any of these problems, and it is especially important to check the teeth of older horses regularly, as they are more likely to have dental problems, and it requires attention of a veterinarian skilled in equine dentistry or an equine dentist. Let's proceed to hoof care. Before we proceed to hoof care, let's watch these two short videos. This horse hooves was not maintained and trimmed regularly, and it cannot walk properly and cannot perform the regular activity comfortably.
Few days at the vet clinic. It was agreed by everyone over his case that he needed a few days to get his strength back, and then we would put him under complete anesthesia before removing the rest of the excess hoof.
The old saying, no foot, no horse, still holds true today. And while as an owner, you can't do much mechanically to the hooves, daily care and observation are vital to avoid problems. The first one is keep bedding clean and dry. So dirty and wet bedding provides the ideal environment for bacteria to build up within the feet. This can lead to conditions such as thrush. So treatment involves moving the horse on the clean, dry bedding and paring back affected tissues. Topical solutions should be applied to the area as recommended by your vet. Pick out hooves at least once a day. The wall needs to be inspected for excessive growth, and the white line should be checked to ensure it is free from the trap grit, which may cause opportunity for an infection if left. Number 3. Check the condition of the shoes. Shoes should also be checked daily for any movement on the foot, as when horses move freely, it is possible for them to catch their shoes. Number 4. Check the horse digital pulse. Feeling your horse digital pulse is a very useful way of assessing. One of the best places to find the digital pulse is over the outside of the fetlock joint, slightly towards the back. So use your thumb and forefinger and apply gentle pressure. And a horse pulse is slow at rest, and often the fingers are moved away too quickly, so make sure you wait patiently to feel the pulse. Lastly, use a registered farrier. An appropriately qualified farrier needs to attend your horse to undertake trimming and, if necessary, shoeing. Overgrown hooves can be uncomfortable, painful, and even cause serious health problems for your horse. Cutting the hoof too low can injure the soft tissues, causing your horse to limp or even worse, become lame. With the availability of better tools, horse owners can trim their pony's hooves. And that said, you need to be extremely careful to avoid unnecessary injuries. So the proper way to trim the hooves of the horse is, first, you need to moisten the hooves. So hooves can be quite tough and even tougher to trim when they are dry. So soaking makes trimming easier and are less likely to injure your horse. The second one is position the horse leg. So your horse should be comfortable for a successful trimming sessions. And never attempt to trim your horse hooves when he is kicking or clearly uncomfortable, because this can result in serious injury both to you and the horse. Place the horse leg in between your knees and use your knees to hold the leg in position. The hoof should now face you, giving you a good view of all the parts, including the wall, white line, sole, and heel. The third one is cleaning the hoof. So soaking also makes it easier to clean the hooves. You must first remove stock mud and soil to get a good view of the anatomy of the hoof and determine much you will need to shave off. Once you get into the correct position, cleaning and trimming will be a bit easier. So hold the horse leg in one hand and use the other hand to clean the hoof with the hoof knife. Reasonably clean. The fourth one is to cut off the overgrown outer hoof wall. To clip this outer wall, you will need nippers. Ensure that your pair of nippers is sharp enough so you can easily remove the excess hoof wall. Hoof nippers work like nail cutters. Just place the teeth of the clippers along the edge of the wall and apply the due pressure to clip off the hoof wall. Do this all around the entire hoof from one shoulder of the heel to the other shoulder. And lastly, file down the hoof wall. So the nippers can cause unevenness along the hoof wall. A metal file, also known as a rasp, will help you even out any jagged edges. Using short and soft stroke, move the rasp around the hoof, targeting uneven spots. Work slowly and being careful not to file the sensitive sole and frog areas. Use the white line in the hoof as a guide to ensure that you are rasping only the safe zone. Let's watch this video on how to properly trim a horse hooves.
Hello, I'm Rebecca Scott from gobarefoot.com.au, and I'm going to do a very basic maintenance trim on this horse. So this is a barefoot trim. I guess we'd call it Australian barefoot trim, maybe the Brumby barefoot trim. I start with the heels, and then I'm bringing it back. I'm more interested in bringing it back than bringing it down. I want to bring the horse's foot under it itself. I'll take out the bars, take down the bars, not out, just. Okay, now I want to make sure that the heels are the same length. It's 5 centimetres. That one's 5, a tad over. I'll just take a smidge off there. Now I want to make sure I haven't left any high points. Slightly high there. Okay. So that's all I do from the bottom. Don't touch the sole, don't touch the frog, except to clean it out. The horse needs the calluses on its frog, and now we'll do it from the top. So I'm just putting a bevel on here, and also takes a bit of the flare off. I don't want to take too much of the hoof wall. That's a protective coating on there, I don't want to take that off. Okay, that's it.
Colic and laminitis. So these are the two of the most devastating diseases facing horses, and a good management can reduce the incidence of either the disease. So colic is a general term for severe abdominal discomfort, which takes one of the 3 primary forms. The first one is the gas colic. From the word gas, it means that the gastrointestinal tract has a build-up gas. The second one is impaction colic. It is the blockage of the intestinal tract that prevents normal movements of the digesta. The last one is a twisted colic. So when a part of gastrointestinal tract becomes twisted, that is causing pain and potentially damaging permanently or killing a part of the gastrointestinal tract. So some signs you may see if the horse is experiencing abdominal pain. And these are frequent turning and looking at the sides and abdomen, kicking at the abdomen, refusal of food, and frequently getting up and down and possibly attempting to roll. So if your horse appears to be experiencing abdominal pain, then you should contact your veterinarian immediately, because the treatment of colic is most successful if it is undertaken immediately. So if the horse is trying to roll, it is a good idea to slowly walk the horse until the veterinarian arrives. So if the horse is not attempting to roll, it is fine to leave it standing or lying quietly in its stall. So feeding your horse adequate forages and high-quality feedstuffs will help to minimize the likelihood of colic. Internal parasites can also cause colic, so an effective and regular deworming program is important to prevent colic. So founder or laminitis is the most serious disease of the hoof, and it is a severe inflammation of soft tissue that may result in permanent damage to the hooves. Overfeeding, stress, systemic illness, or a variety of other factors can also cause laminitis. When a horse is suffering from acute laminitis, you may see shifting of the weight of the front feet, heat in the front feet, and general signs of distress. If you are purchasing a horse, watch for rings around the hooves that may indicate that the horse has had laminitis in the past. Exercise. Exercise for the horse takes various forms: riding, driving, lunging, and turning out the animal are all satisfactory methods. The horse is an athlete and requires conditioning to be fit as well as warming up before any type of stressful activity. So walking is not enough exercise for horses. You cannot allow a horse to stand a stall or not be ridden for months and expect to go riding for 3 to 4 hours without problems. Conditioning horses is also the same as we condition ourselves. So we should keep in mind when determining if your horse is fit enough for a particular activity. Never allow your horse to eat a meal or drink unlimited water immediately after exercising because this can cause colic or founder. The most effective way to cool the horse out is to remove the tack, hose the horse down to remove sweat and dirt, and walk the horse at its own pace, allowing it to take a few sips of water periodically. Once the horse is cooled down, then it can have as much water as it desires. So grooming or hosing down the horse after exercise will remove sweat and dirt and provide an opportunity for you to examine the horse and make sure it didn't receive any injuries during the exercise period. So putting the horse away clean will also reduce itching and irritation to its skin and improve hair coat quality. And that will be all for our report in common diseases and health management in horses. And we hope our presentation has been informative and instilled this knowledge into your mind. Thank you all for listening and God bless.